So let's get started. So quick introduction of myself. Myself is Harshit Chaurasia. I'm the Chief Executive Officer of Program Insider. I myself have guided since the past so many years to more than 50,000 plus students in India and in abroad, especially students, those who are looking for their career in further countries, basically in abroad. With a single vision to give you the correct and the transparent information about how to become a doctor, an independent doctor. I myself has decided to introduce and discuss with all of the students to give them the right and the realistic information about how the scenarios to become a global doctor is currently going on. So there are the guidelines which are defined by the National Medical Commission from India for all the students studying in abroad. So that was first designed on 18th November 2021. There are two things to be said by the National Medical Commission. In the Gazette, one thing which is very, very important for all of you, and one thing is which is very common, out of which you everybody know the answer of that. So let us first read this section. So the duration and the course and the training in subject leading to the primary medical education means the course of duration starting from your primary medical education and the training. The second thing which they have mentioned, the location of the medical college or the institute and the administration of the course or the training. The third one is the total overall course of duration. One they said about the primary teaching, another one they said about the overall course. Because primary teaching is in your college, your clinical posting and the clinical training will be in your clinics or in your hospitals. Okay. The fourth one is your content of the course and the training leading to the primary medical education. So in these 4 points, first point they would like to mention the course of education must meet the Indian course of education time, which is 4.5 years. The third point which they mentioned that the total duration of course that is in India, that is of 5.5 years, that must be complied in Georgia. The third one is the location. Like when you are studying in Georgian National University SU, you are registered in that college, you cannot relocate to Tbilisi State Medical University or this Batumi Shotao or Kotasi or any of the different university. And the fourth one is the content of course or the training of course must meet the general criteria defined by India. So these are the 4 points which are commonly met the Indian criteria. For example, if we talk about the general training, that is of 4.5 years in India, and in Georgia that is of 360 credits, which is commonly equivalent of 6 years. The location is like if you are studying in SU, make sure you must complete your complete education in SU itself. The total course of duration is 5.5 years. However, in Georgia, it is of 6 years. The course content and the training to the medical education that builds on the 19 subjects, and these all 19 subjects are currently trained in the Georgia too. So that also complies the 19 subjects of the core medical program. But one thing which is very, very crucial, that is provision for foreign medical graduate to practice medicine in India. That is a very complicated scenario and that is a very complicated question. No foreign medical graduate shall practice medicine in India unless he is granted permanent registration in accordance with the province of the regulation. Province of the regulation means Georgia. Georgia Medical Council must allow you the permanent registration, which is called as a permanent license as well. All right. So I hope you got a very clear clarification about a gazette designed by NMC on 18 November 2021. Whoever joined the batch of 2021 is complied all the 5 requirements defined by National Medical Commission. So if you are currently in third year, probably you must have to follow all of those guidelines. Okay. So any question anybody has, feel free to drop a chat. I'm happy to help you out. Now, let us understand the Georgian medical education regulations. I have read over the Embassy of Georgia to the Republic of India. That is an official notification given in 2022 by the Georgian Embassy, that is in Yerevan in Armenia. The question which Indian Medical Council, or you can say the Indian Association, asked from the Georgian ministry, does an Indian student allowed to get a license to practice in Georgia as a medical practitioner? Let us see what their answers. Indian medical student after graduation of undergraduate studies, which is equivalent to MD program or MBBS program, can work as a junior doctor, or they can pass NPDQE, that is a board of examination, take that track of residency program on the specialization, which is specialty they choose. For example, I am having an interest in becoming a surgeon, then I'll choose surgery by first clearing this examination to get into the residency program, which is called as a general postgraduate program, and get the license for running independent medical practice according to the following regulations. Now, one more thing to get a more clarity on this answer, take the postgraduate residency course, and after passing the unified state certification examination, get the right to practice independent medical practice. Article 17, Law of Georgia on Medical Practice. So this is an official records which Georgian Embassy mentioned, that if you are an Indian doctor after 2021, we are talking on the batch of 2021, not on 2020, 2019 or anyone else. So if you are 2021 and afterwards, and if you are an Indian student looking forward for getting a practice in Georgia, so if you are an MBBS, which is equivalent to MD, then in that case, you will get a junior doctor, that is JD. You become a junior doctor. You do not have the independent rights to practice. You do not have permanent registration. You have to do residency. I'm sorry, my current mic is not, this mouse is not working properly. You have to do residency. Then you have to give unified state certification exam. Unified state certification exam. Then you have the right to become an independent physician, and then you can work in India. Then you can work in India. Now, I hope most of you have one single question. MD in Georgia is 6 years. What is the course of duration of residency? Commonly, if you go to any clinical program, clinical means surgery, medicine, or something, that starts with 3 years up to 5 years. That is 3 years up to 5 years. If you do surgery in, let's say, orthopedic surgery, then you have 5 years. If you do general surgery, 4 years, medicine, 3 years. Okay. So your actual minimum course in Georgia become 9 years, then only you have the right to come back to India and do the practice. So if you are a batch of 2020, guys, you are free to write FMGE, Foreign Medical Graduate Exam. Why I asked you is because one more addition the National Medical Commission did, that is called another licensing examination. So in 2027, if a student who joined 2021, he will be graduating in 2027. And when he'll be graduating in 2027, he needs to write a national exit test, which is a common platform designed for all the students, including India and abroad, to get the license to practice in India. So those who joined 2020 batch, they'll be getting 2026 graduation, they'll be writing foreign medical graduate exam, and they are ready to work independently. Okay. So the most challenging job which none a single consultant while joining MBBS in Georgia last year guided you, or 2 years back guided you, is this: 9 years of actual course, 6 years of MBBS, 3 years of postgrad, then only you can come back to India as an independent doctor and can work. But my dear friends, one more question I think you guys must have in your mind. What is the language of teaching? What is the language of teaching for residency in Georgia? Because we all know MBBS in Georgia is in English language, right? Because that is for international course. But is it the same in residency too? So let us see a course mentioned in Tbilisi State Medical University. And this is the official screenshot taken from the official website of Tbilisi. And you can read here. I'll be chasing you. Read this: Masters in Epidemiology. This is 120 credits. That is of 2 years of course. And this 2 years of course is in Georgian language, guys. That is in Georgian language. You can see very easily language of instruction, that is Georgian here. So another challenge is if you are planning for residency, plan for very fluent Georgian language too. As far as I know, which is very, very challenging job to again learn a fluent Georgian, because this is much more typical than studying Russian language. So that is another challenge which is going to be in front of you, that your next residency program of 3 years is going to be in the local language. We are here talking about a public health program, master's program in epidemiology, which is again a university-based program. And we are here on the official website of Tbilisi State Medical University. Okay. So I would like to personally know from all of you, is this an eye-opening webinar for you or not? What is currently going on in your mind? Let us jump on what to do now. What you should do now? What are the options you have? So you have certain plans, and I would like to throw some light on that. So you have one plan which I would personally suggest, that is your plan C. Study MD plus residency in Georgia and then practice. Because that is the only route in Georgia. If you want to practice, you have to do postgraduate. You have another plan, that is your plan B. Study in Georgia, means MBBS, which is MD plus residency, and back to India to work as a MBBS graduate. Now, most of you are thinking, why? I am done with my residency, then why you are saying MBBS graduate? Because just one slide before I told you, your residency will be in the Georgian language. And as per National Medical Commission, you are only entitled to get a license if you have an English course. So if your residency course is not in English, that is not valid in India. Your registration is valid, your license is valid, but your degree as a postgraduate is not valid in India if it is not in English. Mark my words, if it is not in English, your residency degree is not valid in India as well. You are just an MD doctor from Georgia, which is an MBBS graduate just off. Means the 3 years which you are going to invest in Georgia is of no use. Is actually of no use. That is just on paper, but of no use at all. But still you have to choose the second plan B if you wanted to come back to India. And this is the real truth which I'm trying to explain you. So let us understand another pathway, that is a global physician pathway. I'm not talking you right away to become a doctor or an independent physician in Georgia. Now we are going to here discuss about becoming a global doctor, a global independent physician in USA, in UK, and in Australia. There are more options, but we are prioritizing these options because these are the top rated options for the Indian students currently going on in the industry. So if we talk about USA, there is an examination which you have to qualify. That is called USMLE, United States Medical Licensing Exam. A quick intro about USMLE. That is a 3-stage examination, gives you the direct residency in USA with a zero tuition fees program. Means they do not take any tuition fees from you during your postgraduate. They give you the complete free education to you. Another point which I would like to add here is they'll give you the stipend of rupees 45 lakhs per year for doing your postgraduate in America, because there is a huge shortage going on in America and they're expected to be having more than 1,35,000 more physicians till 2030. And that's what the reason of making it tuition fee zero and providing you the complete support for your living costs, your well-being, some of your savings as well. Okay, so you'll get 45 lakh rupees every year, which is an average salary which you will get every year during your postgraduate. Okay, now another option you have, that is UKMLA. Why I'm using this word UKMLA? This is a combination of PLAB and MRCP. PLAB is an old exam designed in UK for getting only license. And if you wanted to get a postgraduate, that is PG, then you need MRCP, Masters in Royal College of Physicians. So now in 2027, they'll be launching UKMLA, which is a combination of PLAB and MRCP. Okay, give you the entry to study and work in UK. The UKMLA is basically designed on the module of USMLA. So if you see the actual pattern and conducting of exam and role model and body, so that all relates to USMLE itself. The third pathway is Australian Medical Council, that is AMC. So there are two levels, one plus second. So you have to give 2 examinations. Additionally, one practical assessment in Australia that decides your match in residency. That is a postgraduate pathway of Australian Medical Council. I would like to say one more thing to all of you, that USMLE has the highest success ratio in all the 2 international, basically not 2, it's basically 2 plus 1, that is 3 international examinations, considering the top choice of Indian students. And currently in America, there are 1 lakh plus active physicians who are working. from India. So if you are an Indian, you have to be proud if you will be settling down in America, because there are already 1 lakh plus doctors who are working there as an independent physician. And this is just 1 lakh who are currently working in America. We have seen a lot of doctors coming back to India and they are working and serving to India as well. All right. So the outcome of plan B and C will be this. You still have a question. You are still a junior doctor, or actually you are nothing. You have a very limited exposure. You do not have any independent authority. You have a very big PR issues as well in Georgia. Okay. Because year on year, the population is growing in Georgia. There is a lot of privatization is there. You have seen there are 27 medical colleges. There are 19,500 total beds. And there are only 39,000 active physicians in Georgia. So every one physician is having 2 beds. No, sorry, 2 days, 1 beds. So ratio of 2 is to 1. So most of them are running their private clinics and so and so as. And finally, you know much better than me. You are currently in Georgia. You are seeing all the things very clearly. So studying in Georgia as an MBBS graduate is a prestige because they provide you a very good infrastructure to study comparative to any local country like Kazakhstan, Uzbekistan, and others. But when it comes to becoming a global doctor or a physician, there is a very big challenge going on because of the education system and their policies, not because of the infrastructure. Okay.